Welcome back to Seniors. I'm your host, Jim Mazziotti, a senior real estate specialist and a senior advocate, and a person who believes your later years are not necessarily a slow fade, but a powerful chapter. Today, I want to walk you through a study that frankly should be front page news in every community where seniors live, love, and make decisions. It's a difficult study to really understand, so listen closely. It comes from Yale. It's rigorous, it's hopeful, and it completely challenges the old story that aging is nothing but decline. The Yale study that changes the story. This research was led by Dr. Becca R. Levy, a professor of social and behavioral sciences at the Yale School of Public Health, and published in the peer-reviewed journal Geriatrics under the title Aging Redefined: Cognitive and Physical Improvement with Positive Age Beliefs. Here's what they did. Yale assembled the Health and Retirement Study, known as the HRS, a large, federally supported, nationally representative longitudinal study of older Americans with over 11,000 adults, most of whom were followed up for 10 to 12 years. The focus was on adults 65 and older, studying physical function, and a broader 50-plus group for cognition, with average starting ages in the late 60s and 70s. They measured cognitive health using a validated global cognition test, which included memory and mental skills, and physical health using walking speed, a geriatric vital sign strongly linked to disability, hospitalization, and mortality. And they did something most studies don't. They used methods that allowed for the possibility of improvement, not just decline. The headline from their study: nearly half improved. And here's the part that should make every senior like you and me sit up a little straighter. 45.15% of older adults improved in cognitive function, physical function, or both over the follow-up period of up to 12 years. About 31.88% improved cognitively, and about 28% improved in walking speed. Not just held steady, not just declined more slowly, but they improved. And when you include those whose cognition stayed stable instead of declining, more than half of the participants defied the stereotype that aging is inevitable cognitive deterioration. These aren't rare super-ages. They were everyday older Americans, many with chronic conditions, average education, and very, very normal lives. The power factor: beliefs about aging. Now, this is where the study becomes truly revolutionary. Now, listen up. Dr. Levy and her team didn't just track physical and cognitive changes. They also measured age beliefs, how people think and feel about growing older, using a validated scale called the Toward Agent Subscale. Then they asked, do positive age beliefs predict who improves? The answer was yes. Older Americans with more positive beliefs about aging were significantly more likely to show improvement in cognition and walking speed. They held true even after accounting for age, sex, education, chronic disease, depression, and length of follow-up. In other words, your mindset about aging isn't just a feel-good slogan. It's a measurable factor in how your brain and body change over time. As Dr. Levy put it, improvement in later life, it's not rare, it's common, and it should be included in our understanding of the aging process. Yale School, Why this matters for you, your family, and your choices? Well, I work every day with seniors and their families, helping them make decisions about housing, finances, health, and legacy. And I can tell you, the story we believe about aging shapes everything. If we believe aging is only decline, we lower our expectations for ourselves and others. We delay or avoid healthy changes because what's the point? We talk to seniors as if they're fragile, finished, or past their prime. But ladies and gentlemen, this study says something very, very different. A meaningful percentage of older adults get better mentally, physically, or both. Improvement is not an exception. It's a real and common trajectory. And positive H beliefs are modifiable, culture-based factor that can support that improvement. That means communities, families, and professionals, people like me in real estate, and perhaps you, and senior advocacy participants have a responsibility to stop treating aging as a diagnosis and start treating it as a stage of potential. 3 takeaways you can act on today. Let me bring this down to ground level, into your daily life. This has been a difficult read for me. But here's what you need to do. Watch your language about aging. When you hear yourself say, I'm too old, or what do you expect at my age? Try replacing it with, I'm still capable of learning, improving, and contributing. Because you are. That's not denial. That's aligning your beliefs with the evidence. Second, keep moving. Walking speed matters. In this study, walking speed wasn't just a number, it's a predictor of independence and improvement. One of my recent podcasts talks about this. A daily walk, even at your own pace, is not just a walk, it's an investment in your future self. Third, stay mentally engaged and connected. Read, teach, volunteer, learn something new. Mentor someone younger. They do need your help. Your brain responds to challenge and purpose. Your story is still being written. This Yale research doesn't just give us data, it gives us permission to rewrite the story of aging. Aging is not automatically decline. It can be growth, adaptation, and yes, improvement. So, if you're listening to this Senior to Seniors podcast, and you're a senior, or as a son, daughter, or grandchild of a senior, hear this from me today. You are not done. You are not defined by averages. You are not a stereotype. You are a person with a future that can still bend upwards. I'm Jim Mazziotti, and this is my Senior to Seniors podcast. Your years matter. Your choices matter. Your beliefs matter. And the science is finally catching up to what many of you have known all along. You're still becoming. You're still growing. You still have something to give. You have something to offer your community and your family. Stay young. You're still becoming.